Afternoon, doctors. Welcome you to this webinar on Carbetocin in Action, Case Studies from Labor Room, sponsored by HIT. Heathrow Healthcare has a 25 years of excellence with 36 state-of-art manufacturing facilities. We have 300 plus products in portfolio and presence in 126 plus countries. We have got 21,000 employees globally and we're the largest closely held pharmaceutical company. We are amongst the largest manufacturers of ARV, APIs and FDFs in the world, and we are Asia's largest APIs manufacturing at Visakhapatnam, Andhra Pradesh. Heathrow Healthcare is 360-degree solution provider with striving to fulfill unmet healthcare needs, reaching to customers across India, wide product range encompassing multiple specialties and pioneering in quality and innovation. We have distinction of bringing 4 biosimilar products to market within 5 years of initiation. Today's webinar, Carbetocin in Action. Doctors will agree with me that carbetocin is a drug which is used for prophylactic management of PPH, and PPH is a potentially extremely dangerous condition which can lead to disaster. Although there are many papers and studies on use of carbetocin in PPH, we always like to share our own doctor's experience of use of carbetocin, for which today we have got Dr. Pooja Bansal with us. Welcome, madam, to this webinar.
Thank you, sir, for inviting me.
Dr. Pooja Bansal is MS Obstetrics from BHU, first rank holder. This is wonderful. And a part of champion trial in BHU. In fact, this was a trial which gave birth to carbetocin globally. Apart from other attachments, madam is doing private practice in 6 years in Metrojint Hospital, has received Chikitsak Sanman Award from Honorable Health Minister Haryana, Anil Vij, presented papers and posters in various conferences, trained for USJ from Dr. Randhawa University from ultrasound from New Delhi, trained for laparoscopy and hysteroscopy from TILLT Sonipat, and did hybrid ART training from iSeat Academy, Gurgaon. Welcome, madam, and over to you for the session.
Thank you, sir. Thank you so much for inviting me. And namaskar, good afternoon, everyone. Today we are discussing about the newer molecule carbetocin in case of the PPH. PPH is a nightmare for all obstetricians. As all we know, what is PPH? It is the loss of at least 500 ml blood following vaginal delivery and 1 liter following C-section. It is very common and can occur even in women who are not at risk. PPH is the leading cause of maternal mortality in low-income countries and the primary cause of nearly 1/4 of all maternal death globally. It is unfortunate yet common. It is the leading cause of maternal mortality, accounting for 35% of all maternal death. Global PPH incidence is 2 to 4% after vaginal delivery and 6% after C-section. In case of India, 38% of maternal death are due to PPH. 25% of global death take place in India, and it is a very huge data. 2/3 of these attribute to PPH. India has an unexpectedly high maternal death ratio of 540 per 1 lakh live births. Etiology of PPH, it is 4 T's. The most common is the tone, that is atonic PPH, inability of uterus to contract, which may lead to continuous bleeding. Second is the thrombin, that is failure in the clotting. Third is trauma, any injury to the uterus or rupture uterus, uterine inversion, any laceration. And the last is tissue, that is the retained products of conception. These are the 4 causes of PPH. Clinical findings in PPH. First, clinical finding, any one of these signs like abdominal tenderness, circulatory collapse, increasing abdominal girth, loss of uterine contraction, maternal tachycardia, and vaginal bleeding. That is the most common. If there is any excess vaginal bleeding after the delivery, then we suspect PPH. Degree of the shock, there are 4 degrees. Compensation, mild, moderate, and severe. In compensation, blood pressure changes are nothing, just patient having the palpitation, dizziness, and tachycardia. In mild shock, BP will slightly fall, about 80 to 100 mm of Hg. Patient will have weakness, sweating, and tachycardia. In moderate PPH, marked fall in the BP, and the patient will have restlessness, pallor, oliguria. In severe shock, more than 2000 ml of blood loss, and the profound fall in the BP, patient will collapse, air hunger, and anuria. How we will diagnose PPH? First, initial evaluation of the patient status. सबसे पहले पेशेंट का पल्स बढ़ता है, presence of tachycardia and hypotension. Then assessment of vital signs and the blood loss. At the time of the hemorrhage, we have to assess for any injury of the genital tract, any laceration, hematoma, or any sign of uterine rupture. Manual examination of retained placental tissue. If you have the facility of bedside ultrasound, then check if the uterus is non-contracted. By USG, we can check there is any rupture of uterus or not, or there is any intraperitoneal bleeding or not. Evaluation of uterus to check for uterine inversion. In the laboratory assessment, we will send complete blood count to check hemoglobin, platelet count, and hematocrit, and further coagulation studies for the assessment of the fibrinogen. This is very important. How we will approach towards the PPH. अगर PPH होता है, सबसे पहले हमें कॉल फॉर हेल्प, आपको अपनी इमरजेंसी टीम को हेल्प कॉल करना है हेल्प के लिए, because attempt should be made to identify in cause in women who are bleeding in parallel with resuscitation. हमें साथ साथ उसका ट्रीटमेंट भी करना है और साथ साथ उसे असेस भी करना है. सबसे पहले हमें चेक करना है कि पीपीएच का रीजन क्या है. इट इज पुअर यूट्राइन टोन और एनी ट्रोमा और रिटेन टिश्यू. फर्स्ट वी विल palpate abdomen and check uterus is relaxed or contracted. If uterus is relaxed, that means it may be atonic PPH. Then we will evaluate further. In case of any tear or trauma, we have to repair first this. In case of the retained placenta, we have to examine the placenta and uterine cavity. Management of the atonic PPH, it is the uterotonic agent like oxytocin, prostaglandins, and ergot alkaloids. Now, active management of the third stage, we will study in further slide. Rationale for the development of carbetocin in new heat stable formulation. As all we know, we are using oxytocin since many years. Then what is the reason for the development of this carbetocin? The main reason is carbetocin is available in room temperature stable formulation. Because oxytocin should be kept in refrigerator to avoid degradation, and heat stable formulation of oxytocin currently not available. And resource poor countries do not always have cold chain transport and storage capabilities. तो ये एक मेन रीजन है कि हमें ऑक्सीटोसिन को मॉडिफाई करके एक न्यू मॉलिक्यूल कार्बेटोसिन डेवलप करना पड़ा, बिकॉज इट डज नॉट हैव एनी नीड फॉर रेफ्रिजरेशन, it avoid need for cold chain storage, and it is stable at room temperature. These are the uterotonic agents that we are using since many years. Oxytocin. Now, carbetocin is a synthetic analog of oxytocin, argometrin, symptometrin, and misoprostol. Today, we are discussing about the prophylactical use of carbetocin in the prevention of PPH, that is the active management of third stage of labor. Just after delivery, हाँ, एक्टिव मैनेजमेंट ऑफ थर्ड स्टेज ऑफ लेबर में क्या होता है कि जैसे ही बेबी की डिलीवरी होती है, सेकंड स्टेज के जस्ट इमीडिएटली हमें कार्बेटोसिन देना होता है स्लो आईवी. 1 ampule contain 100 microgram and we have to give over 1 minute before the delivery of the placenta. तो हमें सेकंड स्टेज के जस्ट बाद कार्बेटोसिन यूज करना है. In this slide, we can see carbetocin was created by making several modification to the oxytocin structure. ये इससे हमें क्या होता है कि it prolongs half life. जो हमारा पहले ऑक्सीटोसिन मॉलिक्यूल था, उसकी हाफ लाइफ 4 to 8 मिनट्स होती थी, और अभी जो हमारा कार्बेटोसिन है, इसकी हाफ लाइफ 40 to 60 मिनट्स है. अगर हम इसे आईवी देते हैं, if we give IV, then uterus remain contracted up to 60 minutes, and if we give IM, then uterus will remain contracted up to 120 minutes. This is the carbetocin. One vial contain 100 microgram of carbetocin in 1 ml solution for injection. Clinical evidences. These are the trials. WHO चैंपियन ट्रायल, जैसा सर ने आपको पहले बताया कि इसके बाद ही हमें कार्बेटोसिन के लिए चैंपियन that is the carbetocin hemorrhage prevention. the largest clinical trial in the prevention of PPH. It was conducted by WHO. And these results show carbetocin is non-inferior to oxytocin. These are the comparison between the carbetocin and oxytocin. The frequency of blood loss of at least 500 ml or the use of additional uterotonic agent with carbetocin was proven to be non-inferior versus oxytocin. इनसे हमें यही कंक्लूड हुआ है कि कार्बेटोसिन इक्वली ऑक्सीटोसिन से कॉम्पिटेंसी में इक्वल है, बट इसके फ्रीक्वेंसी ऑफ द एक्सपेक्टेड एडवर्स इफेक्ट्स आर फ्यूअर देन ऑक्सीटोसिन, कि हमारी इसकी पेशेंट प्रोफाइल बेटर है ऑक्सीटोसिन से. This is the Cochrane review. For the women who undergo a C-section, carbetocin resulted in statistically significant reduction in the need of therapeutic uterotonic compared to oxytocin. जब हम पहले oxytocin यूज करते थे, उसके बाद हमें जो फर्दर यूट्रोटोनिक्स यूज करने पड़ते थे, उसके कंपैरिजन में अगर हम कार्बेटोसिन यूज करते हैं तो हमें बहुत ही कम फर्दर यूट्रोटोनिक्स यूज करने पड़ते हैं. यही इसका सबसे अच्छा इफेक्ट है. Guidelines recommendations. WHO 2018 has included for the PPH prophylaxis any one of the oxytocin, carbetocin, misoprost, ergometrin. SOGC Canada also include carbetocin for the PPH prophylaxis. New Zealand, FIGO, carbetocin used. Germany and FCOG. All these guidelines has include carbetocin for the PPH prophylaxis. My experience with carbetocin. Actually, I am using carbetocin since 1 year in my labor room for both normal delivery as well as C-section. And I am getting very good results with carbetocin. The incidence of PPS getting lesser than before. First case in normal delivery. 24-year, gravida 2, para 1, live 1, previous 1 normal delivery, gestation is 38 week, came with labor pain. On examination, per abdomen, uterus was term size, mild contraction, FHS plus regular. Means patient came to me with early labor. On PV examination, os was 2 finger loose, cervix effaced, bag of membrane plus. Spontaneous vaginal delivery occurred after 4 to 5 hours, and I use injection carbetocin, that is 1 vial, 100 microgram, slow IV over 1 minute. Used after second stage of delivery, and the result was very good. Uterus well contracted, PV bleeding normal. The case second in C-section. 29-year-old, gravida 3, para 2, live 2, with previous 2 cesarean section. Gestation is 37 week, came with the complaint of pain in previous stitches. On examination, there was scar tenderness present. On PV examination, os was 1 finger loose, show present. So emergency C-section done in view of the scar tenderness, and I used injection carbetocin after second stage. As usual, 1 ampule, slow IV over 1 minute. And the outcome was healthy female baby and no complication occurred. PV bleeding was normal. In the third case, in high risk pregnancy, 33-year, gravida 6, para 5, live 4, previous 5 normal deliveries, that is grand multipara. This patient at 39 week came with complaint of PV leaking since 2 hours. On examination, uterus was term size, FS plus regular, contraction was seen, and on PV was 3 centimeter, leaking per vaginal plus. SVD conducted after 2 hours. Injection carbetocin used after second stage of labor, and the PV bleeding within normal limit, uterus well contracted, and the outcome healthy male baby 3.2 kg. As in this case, we can see grand multipara is a very high risk for the PPH, for the atonic PPH, but I have used injection carbetocin and everything was normal. It's the time for panel questions.
Yes.
So
Thank you very much, madam. Yeah, thank you very much for your insights. It is very interesting that you have been using over past 1 year or 1.5 years. Any side effect that you have seen with carbetocin?
No, sir, I didn't see.
Single vial use, not much side effects. And efficacy wise, even in your experience
far
during the
better
champion
than
trial, yes,
oxytocin. Yes, sir.
worked very well. All for. In fact, you are using one of the high risk patients, and it worked very well without any side effects.
Sir,
Without it.
I am using in every patient, each and every delivery patient I am using carbetocin.
Generally, you prefer IV route,
Yes, sir. IV route.
not a bolus, but a slow drip,
हाँ नहीं it slow IV over
slow
1 minute
IV drip. Yes,
direct without any drip.
without drip. Okay, slow IV over open.
Yes.
But which are the patient profile? Although we can get PPH in any
Hmm.
patient, I mean,
Hmm.
expect unexpected. Which are the patient profile where doctors can anticipate a PPH?
Sir, in like multi patient having multiple pregnancy, like twins, triplets, or with prolonged labor. Sometimes patient came with 24-hour labor pain,
Okay.
or polyhydramnios in case of low-lying placenta, like grand multipara if she is having 5 or more previous normal deliveries, and
In short, in any condition which can lead to atonic
huh,
uterus.
yes, sir. Any condition can lead
Which
to.
can, or atonic uterus. Even in fibroids, I suppose. But
Yeah,
does a gestational diabetes make them more prone for PPH?
yeah. In fact, in PIH patients also,
PIH also.
yes, there are very risk factors.
When would you prefer carbetocin? I mean, you have preferring carbetocin straight away, but specifically over
Hmm.
oxytocin.
For I think, sir, in case of जैसे कि these are the जो मैंने अभी आपको
हाई
हाई रिस्क
रिस्क, हाई
फैक्टर्स
रिस्क बोला,
बताए
हाँ.
उनमें हम प्रीफर करेंगे। उसके अलावा कई बार क्या होता है कि ना जैसे कि पेशेंट हमारे पास ट्रेन स्टाफ नहीं है कि हम टाइट्रेट
करेक्ट,
कर सकते हैं सिंटोसिन का,
करेक्ट,
तो
करेक्ट, करेक्ट.
ट्रेन स्टाफ चाहिए। 15 ड्रॉप्स पे सेट करना है, 30 ड्रॉप्स पे सेट
ओ,
करना है
समझा.
ऑक्सीटोसिन।
सो प्रैक्टिकल डिफिकल्टी जहाँ है वो.
हाँ, इट इज वेरी सिंपल यूज, इट इज वेरी इजी टू यूज।
वेरी करेक्ट, वेरी करेक्ट.
And cold chain in the condition where is cold chain not maintained, then
In your country, this is a major problem, especially in the periphery when you go to see. Uh,
हाँ, वहां पे
I mean,
रेफ्रिजरेशन नहीं
yes,
होता है या फिर
even
लाइट
in,
नहीं आ रही है।
exactly, even in big cities, there is power outage many times, so
Yes,
the stability could be a problem.
yes, sir.
Can you use carbetocin? Your experience of using carbetocin in retained placenta,
Sir, I think carbetocin is used for the prophylaxis of PPH, not for
PPH,
the treatment. So in case of retained placenta, I think no role of
no
carbetocin.
role of carbetocin. You have to manually remove placenta and
Yes, sir.
then
Under
do whatever. Yes.
anesthesia, we have to manually remove the placenta.
And in patients with RH negative mothers,
I think yes,
shouldn't be
we
a.
can use.
I mean, your personal experience, any personal experience on RH negative mothers?
Sir, I am using in RS negative mothers.
Mothers
It
also,
is safe.
routinely. Can a doctor use carbetocin for prevention of PPH if oxytocin is used for induction? Many people
Yeah,
will
yeah.
use
Yes,
oxytocin.
yes, we can use carbetocin. Actually, इसका जो मैकेनिज्म होता है कार्बेटोसिन का,
हाँ,
uh, अगर if we are using oxytocin for labor induction, then sometimes the oxytocin receptors get desensitized
correct, correct, correct,
after
correct.
prolonged exposure. In that case, carbetocin will attach to the oxytocin receptor, and it will prevent the negative feedback inhibition of oxytocin. So endogenous oxytocin will stop, and now
हाँ.
carbetocin will work on these oxytocin receptor, and they will be sustained uterine contraction.
In fact, it will be better than even
Yes, sir.
oxytocin. Yes.
यस सर, क्योंकि कई बार हमने देखा है कि अगर हम ऑक्सीटोसिन प्रोलॉन्ग्ड ऑक्सीटोसिन हमने यूज किया है लेबर इंडक्शन के लिए, तो वो भी एक पीपीएच के लिए रिस्क फैक्टर हो जाता है,
Correct,
क्योंकि
correct,
इसके
correct.
बारे में हम ऑक्सीटोसिन उस पर वर्क ही नहीं करता है
Okay, okay.
डिसेंसिटाइजेशन। तो उस पर कार्बेटोसिन बहुत अच्छा रिजल्ट करेगा और हम
Immediately.
इजीली इसके देख सकते हैं।
You have been using IV in all the patients, but is there any place for IM route? हाँ, IM route यूज कर सकते हैं,
सर मेरे हिसाब
especially
से
in
तो आईवी रूट
peripheries.
ही बेटर
हाँ,
है, स्पेशली इन केस ऑफ सी सेक्शन तो हमें आईवी ही देना
correct,
चाहिए।
correct, correct.
इन केस अगर कोई पेशेंट आया हमारे पास एडवांस लेबर में आया, जस्ट कई बार होता है कि ऑन द वे डिलीवरी हो रही होती
Yes,
है,
yes,
हमारे
yes,
पास
yes.
आईवी कैनुला एक्सेसिबल नहीं है, इन केस हम उसमें आईएम भी यूज कर सकते हैं।
Periphery में भी IM का रोल हो सकता है when there are no support staff also.
यस
And
सर।
madam, what is your take on a prefilled syringe
प्री फिल्ड
of
सिरिंज,
carbetocin? हाँ,
सर इसका तो मुझे ज्यादा आइडिया नहीं है, मैंने तो वायल वाला ही यूज किया है।
करेक्ट, करेक्ट. ये फायदा होगा प्रीफिल्ड सिरिंज आए तो?
मे बी कि
थोड़ा
थोड़ा
टाइम
टाइम
कम
बच
होगा।
जाएगा।
And PPH every second matters.
हाँ
If the patient is not responding with carbetocin, which additional uterotonics would you suggest that can be used?
Sir, we can use carboprost and mesoprost, prostaglandins. Second
Prostaglandins.
line is prostaglandins, and then if prostaglandins भी work नहीं कर रहे हैं तो उसके बाद हमें uterine balloon tamponade
Okay.
like बकरी सेक्शन कैनुला ये सब हम यूज कर सकते हैं।
And methergine.
हाँ मिथर्जिन भी यूज कर सकते हैं अगर किसी में कोई
Hypertension.
कॉन्ट्राइंडिकेशन नहीं है। और हमें एक बार थोड़ा एग्जामिन भी करना पड़ेगा कि कोई टीयर या कोई लैस्ट्रेशन तो
Correct, correct.
कॉन्ट्रैक्ट है या नहीं है।
Ensuring that is only atonic PPH.
Yes, sir. It is mainly for atonic PPH.
Atonic. What are advantages of carbetocin? Here, madam, particularly I want to ask you, have you seen a side effect with oxytocin, especially ADH related side effect?
सर एक्चुअली ऑक्सीटोसिन का जो मेन यही है एंटी डायूरेसिस।
Yes, yes.
वाटर इंटॉक्सिकेशन बहुत ज्यादा होता
Correct,
है
correct, correctly.
प्लस इससे हाइपोनेट्रीमिया हो जाता है। तो
Correct.
कार्बिटोसिन एडीएच से बहुत कम पोटेंट है,
Important
24
है।
टाइम्स लेस
हाँ
पोटेंट
हाँ।
है।
तो
तो
उसका ये
इसका
नहीं है साइड इफेक्ट।
यस सर इसका वाटर इंटॉक्सिकेशन वाला साइड इफेक्ट बहुत
नहीं
ही
है।
कम है।
करेक्ट।
एंड कोल्ड चेंज नहीं चाहिए
नहीं चाहिए।
कार्बोटोसिन में। इसकी हाफ लाइफ भी प्रोलोंग है तो
एज
हमें
कम्पेयर टू
इंजेक्शन
यस
में नहीं
ऑक्सीटोसिन।
देना पड़ता है। एंड misoprostol has having significant nausea, vomiting,
ऑस्ट्रिया।
diarrhea. Then
प्रोस्टाग्लैंडिंस।
these are very less with carbotocin. कार्बोप्रोस में भी फिर कोल्ड चेन चाहिए।
और एस्थमेटिक्स में दे नहीं सकते
एस्थमेटिक्स में
बेसिकली।
नहीं दे सकते, प्रीवियस कोई हार्ट डिजीज है उसमें भी हमें थोड़ा ध्यान रखना पड़ता है।
मिथाइल
और
एर्गोमेट्रिन इज बीपी शूट अप ऑफ कोर्स।
हाँ मिथर्जिन से हाइपरटेंसिव पेशेंट में नहीं दे सकते, प्लस नोजिया वॉमिटिंग भी बहुत एक्सेस में
अच्छा,
होता
मिथाइल इसमें मिथर्जिन से भी, मिथाइल
है।
एर्गोमेट्रिन से भी।
दोनों से होता है।
Should carbetocin be kept as a reserve drug or should be used as first line?
आई थिंक इट शुड बी यूज्ड एज ए फर्स्ट लाइन
First
ड्रग।
line.
आई एम
That was
यूजिंग।
the yes. How do you compare adverse effects? Side in fact, your big trial, champion trial, showed that the side effects is less and much. I mean, it should be a better option to oxytocin in terms of practical use, I suppose. Less side effects, almost equal efficacy.
It causing I think less tachycardia,
Okay.
and in case of cardiac patients in
Yes.
fact further studies are ongoing for the low dose of carbetocin.
Okay.
Because it is better hemodynamic profile than oxytocin in case of pulse rate and BP.
कहाँ स्टडी चल रहा है आपके हॉस्पिटल में, चल रहे स्टडीज?
नहीं 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 नहीं।
ग्लोबली ग्लोबली।
ग्लोबली सर।
ओके ओके, लो डोज इज 50
लो डोज
माइक्रोग्राम।
कार्बेटोसिन
ओके
मैंने कहीं पढ़ा था कि इस पे
ओके
भी
ओके
स्टडीज चल रही हैं। तो जो कार्डियक पेशेंट है, एरिथमियाज वाले पेशेंट है, उनके लिए
ओके
स्पेशल।
ओके। एंड लास्ट इज योर वन टेक ऑन दिस ड्रग।
So, of course, it has better efficacy and better safety than other uterotonic.
So worth using, worth trying, worth keeping in mind.
Yes, sir.
Thanks so much, madam. In fact, your experience as a part of a champion trial made it more important, for doctors. So it's a very huge, large trial.
Yes,
And
sir.
although, as I said, there are many papers, our own doctor's experience is always important. Thank you very much for sharing those case studies also. Thank you,
Thank
marketing team. Thanks to all the doctors for taking time in their schedule and attending this. Thank you, marketing team, Hetero and sales team for coordinating and conceptualizing. And thanks, IT team, for your IT support. Thanks, all of you. Madam, wish you a very pleasant afternoon, pleasant evening. And
thank you.
signing off, wish you a very pleasant and excellent 2025. All the best for the napping year. Thank you.
Thank you so much.
You can sign off. We can sign off, madam.
Okay. मैंने बहुत फास्ट कर दिया आई थिंक।
Right. It's okay. I mean, the experience are experience.
हाँ एक्चुअली मैंने